I know why dental practices and dental professionals don't sell more teeth whitening, and this is so sad. The thing is, teeth whitening is the hidden gem in your dental toolkit. I mean, it can also help drag you away from the drudgery of drilling and filling and provide more disposable income for the practice or for you. So would you like to know why I believe dental practices don't sell more whitening and how you can quickly increase your revenue? I'm talking $100,000 a year just with a simple change of mindset. I'm Stephen Douglas, your trusted teeth whitening advisor. Stay tuned and all will be revealed. Welcome back to the Teeth Whitening Secrets channel, where we help dental professionals easily create highly efficient and profitable teeth whitening departments while significantly improving the results of the patient outcomes. With a market sector set to double over the next 4 to 6 years, yes, double, you would think that this will be a no-brainer, right? Well, sadly, this is not the case. So let me explain why dental practices and teams don't provide more teeth whitening for their patients. Teeth whitening is not an exact science, well, for now. It is not clinically taught in university, so I believe it could be viewed as a low-value cosmetic treatment, kind of not so important. And because it's not deemed worthy of being part of a degree, dental professionals are, left to their own devices to find out how to whiten teeth on their own. And this carries a risk. Because of this, they can lack clarity, lack confidence, and are often worried about the disappointments that their patients may obtain. So with that in mind, if we can resolve these 3 problems of a lack of clarity, confidence, and worried about disappointment patient, how do you start more treatments? Firstly, having a medical history form question, asking if a patient is unhappy or happy with their smile, or if there is something they would like to improve in their smile, is okay. It provides an indication, but nothing more. A better way to have this discussion with a patient is face-to-face or one-to-one. I also think that this is another reason why dentists don't start as many whitening treatments or other cosmetic treatments, as they might feel uncomfortable in asking a patient, "Am I right?" Now, I understand this as it's not easy and it might seem a little confronting to talk to patients like this. Secondly, and here's the thing, if you wait for patients to ask, you get lumpy cash flow and lumpy treatment plans. If you engage with a patient about teeth whitening, you don't. The most crucial thing you must do is change the mindset about teeth whitening. And this is how. Every patient consult must include a question about teeth whitening. Hi, today I'm at Magical Smiles in the beautiful area of Caroline Springs in Victoria. I've got the gorgeous Dr. Whiten, who's principal dentist at owner. One of the biggest challenges we have in the dental industry is lots of people, adults, come whiten their teeth, but they're not coming to seek the help of their dental practitioner. And what I'm told by many dentists is they sometimes can feel a little bit uncomfortable in broaching the subject of improving their smile. So here are 3 really easy ways that are inoffensive, nice and easy, in which you can talk to your patient. The first way is to use a dental mirror. Okay? This takes the pressure off the dentist by the patient is focusing on their smile. So Rashna, we've had a fantastic consult today. Everything's tracking really, really well. Just as a matter of interest, if we could wave a magic wand, would there be anything that we'd like to improve on your smile?
On my smile?
On your smile.
Yeah, I think the color can do better, the shape, the size, yeah.
So not too much there. That's a really easy, inoffensive, nice way of talking to a customer, talking to a patient. Now, another way is also looking at the oral health risk, because many people do go to other places to whiten their teeth, like salons, spas, tattoo parlours, hairdressers, beauticians, or online pharmacies. That's dangerous. So another way to have this discussion with the patient is to say, Rashna, everything's going really well today, fantastic, your oral health is really great. Just as a matter of interest, have you ever considered whitening before? Because there are lots of places you can buy whitening from, and it can be a little bit dangerous, or you can actually waste money. Is this something you've considered before?
Yes, I consider it every day, all the time. Every time I smile, I'm considering whitening. I'm thinking, I'm wearing a white shirt. I look at my smile, and every time I'm just comparing. I mean, my God, my teeth are so yellow. It's just the perspective. So, and the irony is I have to wear white clothes all the time.
You see, and that's absolutely fantastic. So the patient has now said, look, I really am considering whitening my teeth. And now as a dental practitioner, you've got the confidence and skills to go, well, Rashna, that's fantastic. With what we now know, the best way to get longer lasting, whiter teeth is just from the convenience and the comfort of your own home. It probably takes about 2 or 3 weeks because the magic is time on the tooth. Would that be something you could do?
Yes, absolutely. If I have to get my teeth whitened, I have to do something.
And there it
That's
is.
the least I can do.
It's as simple as that. Now, the final option is by using the Whiten shape guide. Okay. Now, all we're trying to do is put a flag in the ground for the patient because many patients will forget their tooth staining. So a good way is to talk to the patient and say, for our clinical records, we now integrate a question about your tooth stain. And we just show the patient a Whiten shade guide. We pull out the respective shade that we think will match the teeth. Okay. And then we note down in our medical history form the actual reference of the shade guide. Now, it's important here to talk to the patient about the staining, whether it's yellow, off-white or grey tooth. And at this stage, you see with the Whiten shade guide, a patient can see where they are. They can also see B1. And at this stage, you can say to the patient, if there's something I could show you that would get you closer to this shade, would that be of interest to you?
Yes, definitely.
Well, that's fantastic. Now, if a patient says no, now this is important, if a patient says no, that is fine, because a no means they're not really worried about the tooth shade, they're not going to buy products that are perhaps dangerous, and from your medical history form, in 8 months' time, you'll just see Rashna again and just say, hey, tooth stain's tracking okay, this might be something you consider. And that's it, just 3 really easy ways to engage with a patient. Nice and easy, nice and comfortable, and it's not been a salesman. What we know, the most effective way to get superior, long-lasting whiter teeth is by whitening them in the comfort and convenience of your own home over 14 to 20 days. That's it, simple, inoffensive, polite, and you provide a patient with appropriate choices. Well, this may have taken me a little while to explain. In terms of clinical time, it's no more than a minute or 2. A yes answer should lead to a maximum 30-minute whitening consult. Now, if you're a principal dentist, practice owner, or an associate that perhaps lacks a little clarity with whitening, maybe from past experiences, lacks confidence through poor results, and are worried about the disappointment of patients, then I can help you. The Expert Whitening Secrets training program is a 75-minute live one-to-one strategy session that will give you the exact clinical protocols and strategies required to maximize top-line revenues. To get started, click the link below this video where I'll be waiting to meet you. This is Stephen Douglas, your teeth whitening expert, and I'll see you very soon.